I couldn't convince Judith to say a few words. I think she's speechless, truly. Well, so Judith, thank you again, and congratulations. I understand from your family you're doing a lot of dancing these days. I don't mean enjoy. She loves to dance. Anyway, so we now really turn to the main program today, and it will be webcast live and can be accessed on our new website, which is nam.edu. In addition, it's also being tweeted on Twitter, which is using the hashtag n-a-m-m-TG. You got it. Okay, so I just think that I need to begin by saying what a great program that the committee has put together. And I will really want to recognize the people who really put so much work into this, which is a program planning committee. First of all, we now have a standing program committee from the council, plus expert participation of program committee members. So let me certainly acknowledge Nancy Adler, the chair, Gil Oman, and Al Reese, with the expert participation of Kelly Brunel, Barbara Hansen, and Ken Polensky. And of course, staff, let's not forget, hard work, Charlie Alexander, Elizabeth Finkelman, Morgan Kenrack, Lauren Shern, Megan Slavich, and Carrie Virgo de Durs. So let's join me in really giving a round of applause ahead of the meeting and to thank them for all the hard work they've done. Now, it's customary for the chair of the planning committee, program committee, Nancy Adler in this case, to come and open the meeting, but I really want to take this opportunity to make a special welcome and introduction of our special guest, Dr. Margaret Chan. You know, she's come all the way from Geneva, or maybe she was in Philippines, to join us, and we really appreciate it. But as all of you know, that Margaret Chan is the Director General of the WHO, and she's been there at WHO since 2003, starting as the Director of Department of Protection of Human Environment. But she was elected to Director General's position in 2006, and as Director General, she oversees a vast portfolio that have many priorities, among which is what we're going to talk about today, which is obesity and type 2 diabetes. Now, Margaret is a fellow paisan, or sister, because she and I both grew up in Hong Kong, a little village called Hong Kong, where, of course, she's done so much more than I have, and now, you know, being currently the director of WHO, but previous to that, she's the director of the Hong Kong Department of Health, and as director, she was widely recognized for effective management of the avian influenza outbreak in 1997, and of course the severe respiratory syndrome SARS outbreak of 2003. And of course she managed these very difficult challenges with leadership, and more recently Ebola, which has been very difficult, I know, for her and everybody else. I have to say she's managed it really well with focus and leadership, for which we are really appreciative. So Margaret, we are delighted to have you here with us today, and we truly appreciate you travel a great distance to provide us with a great perspective of this really important issue. And with that, I'd like to turn back to the planning committee and ask Nancy Adler to come to the podium. She's the chair of the planning committee. Many of you know she's a member of my council, professor of medical psychology and Department of Psychiatry, Pediatrics, director of Center for Health and Community at the University of California, San Francisco, and she is just terrific. Join me.
Thank you, Victor. On behalf of the Planning Committee, I would like to welcome the distinguished members of the National Academy of Medicine, our speakers, our guests, and the viewers of our webcast. Thank you for joining us for this very exciting program. As you know, the topic is reversing the dramatic 30-year rise in obesity and type 2 diabetes. We're all aware of the unprecedented rise in the prevalence of diabetes in the U.S. and globally, which is tied to the increase in overweight and obesity. We chose this topic not only because it is a major public health crisis, but its solution is going to be complex, and it requires the expertise of all the members of the Academy and should be of interest across all sections of our organization. Today, we'll consider the drivers of obesity and diabetes, the clinical management of these conditions, and population-level interventions. You'll be hearing not only about the problems, but also about some promising solutions. Now, in line with the topic, we've made a couple of changes to how we organize the program, and I'd like to point these out to you. And this is going to be an experiment, so hopefully this works. We just thought it would be good to implement some of the ideas that we've come up with in research as helpful. One is to avoid long periods of sitting. So what we're going to ask is, when you applaud, stand up and applaud. So we will have standing applause, which will not only be good for you, but wonderful for the speakers. Second, you may have noticed that when you came in, there was a table with exercise bands. If you didn't get one, pick one up. There are different levels of difficulty, and you can use them during breaks, during lunch, whenever you would like. The third thing that you'll notice is that the food choices are a little different this year. There are healthier options, and there will be no soda served at lunch today. Yes. So our pilot test so far is looking positive. That's great. So we have the benefit this morning of two keynote speakers who will really set the foundation for the day. Our first keynote will be Margaret Chan, Director General of the World Health Organization, who will provide the global perspective, and she will be followed by William Dietz, Chair of the Redstone Center at the Millikan Institute of Public Health at the George Washington University, who will provide the U.S. perspective. In inviting Dr. Chan to the podium, I'd like to note that along with the achievements that Victor just noted, in 2014, Dr. Chan established the Commission on Ending Childhood Obesity to identify the most effective approaches to addressing childhood and adolescent obesity in different contexts around the world. Please join me in welcoming Dr. Chan.